Okay guys, I have been trying to vlog for YouTube for a while, but what ends up happening is that I'm either like really tired and I don't vlog like the end of the day, or I forget. And I definitely want to vlog a little bit of these because it's my last rotations as medical student and I can't believe it, and I'm really enjoying and learning a lot. I'm having fewer patients than I'm used to, so it gives me the opportunity to do a deep dive into cardiology, which is the rotation I'm going through right now, and learning as much as possible so that I can deal with these conditions as an internal medicine intern. I'm really enjoying it and I'm excited to learn more. I have around 1.5 weeks left, so I want to vlog a little bit today. We're going to hopefully finish the vlog in at least 1 or 2 days. Today is Thursday. I have a heart failure patient, heart failure observation from yesterday. I'm gonna go check on him. I'm at home now, so I'm gonna head to the hospital, see them. Sometimes they give me a patient to see before rounds. Usually rounds is at 9:15, and then we do also afternoon rounds. So we'll see what the day brings, and I'm gonna try to vlog as much as possible today. So still my walk to the hospital. I just wanted to mention I have a patient already to see, a new one that's having some chest pain and EKG changes, and they need to be on dialysis. So nephrology is asking for cardiac consult to see if it's okay to dialyze them today. So I'll see the chart and go see the patient, and then before rounds at 9:30. So I'm walking to my patient's room right now. I read his chart and jotted a couple of notes about his story, and now I'm gonna just ask him what's going on. Apparently he's having chest pain, chest tightness and abdominal pain. I don't know if they're related to each other or two different things, so I have to investigate further. Nephrology saw him because he has end-stage renal disease, and we're trying to see, and they asked for clearance from cardiology because the hemodialysis puts stress in the heart. Okay guys, so we discussed our patient that was getting cleared for dialysis. No cardiac contraindications to the dialysis, so we're gonna clear him. He's good. He's having non-cardiac chest discomfort and it resolved, and we were just consulted to clear him for dialysis in the setting of a new, not new, but intermittent left bundle branch block, which gets everyone scared, but some people can have it just to a conduction disorder that is chronic, that is not concerning if they have had it before. So he's clear. Now I'm gonna go see another patient in the ED that's probably heart failure exacerbation. Okay, just finished seeing the patient. It's a little bit difficult to get history because she was like a little bit frustrated from being in the hospital since yesterday without a room. I use a mask when I'm in the patient room because everybody is getting sick nowadays, and I don't want to risk, getting a virus or giving someone something. But yeah, we have to. I'm gonna go discuss the case with the attending and the fellow after lunch. Right now I'm gonna lunch, and then we should make a decision on what to do. But it's definitely heart failure exacerbation. We don't know which medication she's taking, how she's taking them. So it's a little bit complicated. It takes a lot of patient education to deal with these chronic conditions. Okay guys, so I'm exiting the hospital now. I finished seeing my patients and doing afternoon rounds. The attending does mostly table rounds, so we get to see the imaging. It's a lot of learning, so I really enjoyed it. I'm just really tired. It's 5 p.m. So I'm going to go home now. My patient ended up, my second patient was heart failure, acute or chronic decompensated heart failure, 3 hospitalizations, a lot of compliance issues and inability to get much history. But we are starting, to do the diuresis and get a echo to have a baseline here in the hospital, and see if she improves tomorrow. do a little bit of medication optimization. Oh my god, my hair is crazy. But yeah, I had a great learning day today. So tomorrow I'm not coming to the hospital because I have an interview, but I'll be back on Friday. I know I said it was Thursday, but no, it's Wednesday today. And tomorrow interview day. Good morning, guys. This is a new day. I'm doing a last week of cardiology. It's Monday. We're gonna do our 100%, try to learn as much as possible and see what the day brings. I will be studying a lot, trying to kind of summarize everything that I have learned these weeks, and yeah, vlog as much as possible for you guys. Okay, so I had a pretty light morning, but now it's the afternoon. I got a consult to see a patient in the ED that passed out and has an abnormal EKG. That's it. There's not much information, so I'm just gonna talk to her and see what's the detail. How did it happen? Did it happen at rest? Did it happen while she was exerting herself? All of those clues, and yeah, I'm thinking they're possibly just trying to rule out for a cardiogenic syncope, which can be really dangerous. Okay guys, so I just got out of the hospital. I had a really busy afternoon. I'm going home. It's almost 5:48 now. So pretty long day for cardio. Usually we end up by 5. But I did have that patient with a syncope. It did show some abnormal changes in the EKG, but turns out she had those from before. Just because she was from the Virgin Islands, we didn't have records of it. But then the daughter found out another EKG which had that same changes, so it's less concerning because it's not new and it's LVH. It wasn't an acute ischemic change or anything like that. She didn't have any chest pain, anything concerning for cardiogenic syncope, and she did have a little bit, not a clear trigger, but a little bit of lightheadedness before the syncope event, so it's most likely vasovagal. So yeah, like I was saying, a vasovagal syncope, which is the most common one, is a type of reflex, and it can happen in the setting of usually a normal heart that gets like an adrenergic surge or a trigger that leads to having a parasympathetic system activated and cause you to like pass out. And it usually comes with a little bit of a warning, you know. The patient at the beginning said that she had no warning before, so because of the changes in the EKG and everything, they thought it could be arrhythmia provoked, or and she had a history of palpitation intermittent, but we don't think that's related to the syncope. So that's what they were trying to rule out. Cardiogenic syncope can be a little bit more dangerous, so that's why you know, cardiology was consulted, and they're going to just monitor her via telemetry and see if they find any, you know, arrhythmic changes or anything like that, but that's less likely, and it's most likely a vasovagal syncope that resulted from you know, a trigger or a dehydration, something that she did. With syncope, it becomes a little bit of like a detective work, but the patient didn't give me like enough details, or you know, that could contribute to that, like a trigger or something new that she has done. I asked about all of that, she denied. But still, the most likely diagnosis is vasovagal. So that was for today's patient. I am going home, but thank you so much for accompanying me in these few days of cardiology. I think I may continue to vlog later on, but we'll end up this video for now because I think it's gonna run out a little bit long from what I have gathered already. But yeah, thank you so much for watching, and I'll see you in the next one.